So if let's say all these patients, the potential IVF patients, they want to understand or know more about these kind of treatments and they want to educate themselves, what are like some 2 3 free resources for them that they should go to these websites or these YouTube channels where they'll get awareness about IVF?
Can I plug myself?
Of course.
We have drmalpani.com.
Yeah.
It's one of India's oldest medical websites. In fact, we've been telling doctors for the last 20 years, like I told you about the personal branding. I said the reason medical practice has become so corrupt is because of this middleman. The middleman is either the family doctor or the corporate hospital or the tout or whatever else it is. It doesn't matter. You have to cut out the middleman. And the only way to cut out the middleman is to go to where the patients are, and they're all online. So create your own website. So that's one thing which we've always said. So we've had Dr. Malpani now for 20 years. And it's evolved over the time, obviously. And we think that's great. It's great for me because anytime a patient asks me a question, I have to think. Because if one patient has this question, hundreds must be having the same question. Then I create a video which answers the question. I create a web page which answers the question. I create content around that. So that once that question is answered, it'll hopefully help 100 other people who will get that same information. So it's literally a one-to-many kind of relationship. And I think, the word doctor is derived from the word dossier, which means to teach. People forget that. Now, good doctors have always taught patients, but the trouble is you've only done it 1-to-1 because that's what your technology allowed. Now you have the ability to do 1 to 1,000. And again, people get angry when I say that, but I said, I think it's unethical for a doctor not to have a website. Because when you have the opportunity to teach patients in their own language as a trusted figure, why does a patient want to go to Mayo Clinic? They don't really care what's happening and they don't understand the brand names. They don't understand the English accent. They don't understand. They'd rather get the information from their own doctor. Now, if their own doctor is not providing the information, then they're forced to go somewhere else. No? And then doctors get irritated. कि तुम Google पे क्यों जा रहे हो? डॉक्टर साहब, अगर आप खुद की वेबसाइट करते तो मैं गूगल पे नहीं जाती, मैं आपकी वेबसाइट देखती और उससे मैं सब कुछ सीख लेती, तो मैं आपका भी सर नहीं खाती और मुझे मालूम होता क्या होने वाला है और क्या नहीं. बट बिकॉज यू हैव नॉट क्रिएटेड योर ओन वेबसाइट, यू आर फोर्सिंग मी टू गो टू अदर प्लेसेस. बट अगेन दैट्स जस्ट माय ओपिनियन.